founder of Next Health, and we're here with one of our good friends, a friend of our business from the very beginning, Dr. Apostolos Lekkos. He has been, I met him actually as a neighbor. We live in the same town in Malibu, California, and he started his journey with functional medicine even before I did a few years ago. And he's now a premier functional medicine doctor in Los Angeles. He has been featured on Goop. I've seen you all over the place on the lecture circuit, and it's exciting to have you here.
Yeah,
thanks for joining us.
Thanks. Good to be here.
Yeah, it's great.
Exciting. Congrats to you too. This has been an amazing thing that you guys have pulled off.
Thanks.
2 centers now going to New York, like you said.
Right.
I just got a tour. I've never been here before, and it's pretty impressive. I mean, you offer the top notch of everything. It's like, so
Thank you.
That's
Thank
all
you.
to you guys.
Bring the best of the best under one roof.
It's very cool. Very cool.
You knew us when we were a baby, when we had our first little center in West Hollywood.
Before that, you're like thinking about doing
that. We were thinking about it.
And I was like,
you were brainstorming with us in the early days.
I remember that.
Yeah.
And I was like, well, look at this now. This is amazing.
Yeah, it's a reality. Thank you. Thank you. Yeah. So love to start off just kind of getting your story again for all of our listeners and why functional medicine, and tell us a little bit about kind of how you stumbled into this path.
Sure. Well, I was trained, as you know, in emergency medicine.
Right.
And I just now stopped doing it after 20 years last month.
Congratulations.
I know. It's been
doing what you want to do.
Bittersweet. It really is. However, I never forget the day I went to the ER to work a shift. Because I think I was my 3rd year out of residency. I sit down at the desk and I'm overwhelmed with this feeling of like, this is not what I'm supposed to be doing with my life. And I was like, this is just crazy. Like, I just went through medical school. I went through residency. It was brutal. You've done it. And this is just not fitting with me. I don't know what, this was such a strange feeling I had. And I was just so crushed. And so I was like, began the search for what am I going to do with myself now? And I was seeing in the ER how the medical system doesn't work well. Everybody's coming in. It's the same people. Their drug list is getting bigger and bigger and bigger. I find myself just writing prescriptions to treat symptoms. So I was like, there's got to be a better way. So I started researching into alternative therapies, and I stumbled my way onto functional medicine. I go to my first functional medicine course. It was like that Oprah aha thing where you're like, oh my God, this is it. I seriously felt like this is it. This is what I'm supposed to be doing with myself. Awesome. So I did the whole fellowship and got my master's degree in metabolic and nutritional medicine. And, I was, you feel like a resident again. It's weird. Like you don't understand how this medicine works and what do I do with it. And it's like starting all over.
It is.
Totally.
Can I ask you a question about that from a layman's perspective? First, you go into medical school and then you have this aha moment at a functional medicine conference or whatever it is we went to. How different is it from what you learned as a doctor in medical school? What level of the foundation that you had is then carried over, or does it truly feel like it's literally starting from scratch?
That's a great question. I would say mostly starting from scratch, honestly. Wow. It's so different. It's good to know what you know, because not everything fits in the functional medicine box. Like Western medicine has its place. So it's good to know those things, especially being ER, because you know everything about everything.
Right.
But it is so different.
Yeah.
It is so, so different.
I think for me, like, correct me if I'm wrong, but I feel like in medical school, you get all the basics. Like, how the chemistry works, the cell biology. But then when you go off into residency, you really focus down one pathway. But all the pathways are disease care.
Right.
They're all reactive disease care. And for us, like for me doing surgery, like I thought I knew everything about everything. I was operating on every single organ that there was, taking care of people in the ICU. But it really was coming back to medical school and then starting from scratch from where I finished medical school for me.
Wow. When you went into functional.
When I started learning about functional medicine, right? Because it was about treating people at the core of what the problem is. That's versus, right? Exactly.
That's it.
Yeah. Crazy. It's almost like you have to go to medical school twice.
Medical school was actually good for both of them. It was going through the residency training aspect twice.
Right. Yeah.
It was like learning about instead of learning about taking care of the disease, how to stop it in its tracks. Yeah.
Fascinating.
And the thing is, too, they don't teach us in med school preventative care or how to keep you from getting sick in the first place. Yeah. It's like, wait till you're sick, then, here's your pill for your symptom.
Right.
And I don't care how you got that problem. It's the
Yeah.
same pill for the same thing.
Right.
With anxiety, there's a million ways you can get anxiety, but
Mm-hmm.
go in this little box and here's your Ativan or
Right.
Xanax, and that's all you get.
Yeah.
Doesn't work that way.
Right.
I heard once that whole, a pill for every disease thing came from antibiotics being discovered, right?
Mm-hmm.
Where, we discovered penicillin and now there was a pill for that disease, the infection.
Exactly.
So let's try to find a pill for everything else, right?
And they did.
And that's where that created this $1 trillion
Yes. Right.
pharmaceutical
Like,
industry.
oh, this worked good one time. We made a lot of money. How can we replicate this?
That guy made a lot of money off penicillin.
Exactly. You can go down that rabbit hole. Like this big pharma want us to even get better.
Right.
Mhm.
It would be totally
Bad for their
against-
business.
Right.
Terrible for their business.
Yeah.
That's why I see a lot of things and aren't really looked upon highly in this country that could possibly help people because it disrupts that industry.
Right.
Like ozone and other things. In Europe, they use a lot of.
Mm-hmm.
And we don't use that.
Yeah.
Right.
Right.
Well, because they can't make money off of it.
No,
Mhm.
we can't.
Yeah, we deal with those challenges here with Next Health. I mean, what we do goes against that, and it's a challenge for us to get some of the the vitamins that we need for IV therapy because it's keeping people healthy. And
Right.
we have to jump through loops like crazy, and constantly we have this vitamin that we need, and this lab, the FDA's dealing with shutting them down or putting regulations. We have to jump through all these different loops. It's like they make it so difficult to want to preventatively keep people healthy.
That's right.
Yeah.
Crazy.
Makes you wonder.
Yeah.
Kind of.
So sorry, I cut you off. I really want to hear about the story, though.
Oh, no,
so
it's
you had the aha Oprah moment, and then where do we go from there?
Yeah, then I was like, this is it, man. I went just full in. I did the whole program, got certified, etc. Started practicing in Texas, and it was small, kind of, just kind of dialing in a little bit, learning some things. And I realized that the West Coast is where you need to be if you want to be a functional medicine. Like the West Coast is more open-minded. I had a pull here. I've always had it. I don't know why. But it's just my path. And I did end up here. And then I started practicing medicine here in Santa Monica, and things just started rolling, and things grow and grow and grow. And you learn, like every patient you see, you learn something from. And this stuff works. It's insane how good it works. And you see people who have seen 5, 6, 7 doctors. They don't know what the hell's going on with you. And then you can figure it out. It's just the most amazing, rewarding feeling of all to like change somebody's world when no one else could.
Yeah.
It's just, I don't know. I'm just so passionate about it. I can't, it just makes me want to cry sometimes. I mean, it's really, really cool. It's really
yeah, it's good stuff.
And then, now I'm just learning more as I'm going. And I'll can get into this more if you want to, but I'm learning that it's not about the body so much as I thought. It's more about mind, body, spirit, and the body and the spirit and the mind are more influential on the health of people than the body is. So what I mean by that is that the way people think really, really is affecting their health. The records people play in their mind about themselves, the perceptions they have about them, the world, reality, childhood trauma, childhood events that a little 6-year-old kid decides that he's not lovable or not worthy or stupid. They let that record run in their mind all the time. And that they don't even know they're doing it until I bring it up to them. Because we're learning now that our thoughts have power, our thoughts have energy, our thoughts are changing the quantum level. And biology really is just quantum physics. So if your mind, and we have science to show that our mind changes the quantum physics level, we're changing the biological level. So our patterns of thinking are creating disease in our body. And people are storing emotions in their body. Learning all that too now. There's a lot of new stuff going on in the world of mind body. And it's like Joe Dispenza's book. I don't know if you read that, Becoming Supernatural.
Sure.
Is amazing.
Great book. Right.
Really good book. So I'm starting to shift to those modalities and teaching people how to meditate, how to think about things differently, how to deal with stress differently, how to deal with yourself differently, how to find out who you really are inside and to open that up. And I'm seeing people get better without really needing so much of these other things.
Yeah.
Right.
Wow.
Yeah, it's really cool.
That's
That's
incredible.
mind blowing, actually.
It
to hear
is.
you talk about it that way. So, like, okay, let's back up just real quick to the burning question I want to ask you, just so our listeners really understand what it is you do. How would you describe functional medicine? Because this is something that a lot of people have not heard of. Of course, our patients that come here, they're in the know because we talked about it. But how would you describe it, or define it, really?
What it's not Western medicine. Well, Western medicine has its place for sure, like what you do, operating, acute care, ER, heart attack, stroke, break your arm. That's where it works.
Right.
But where it doesn't work is preventative care. It doesn't work with getting you well and keeping you well. So what functional medicine is, like you mentioned, is looking for the root cause of the problem. Symptoms to me are just telling me where a fire is burning somewhere else and let's go find the fire. But find the fire, put that out, symptoms go away. So root cause. Functional medicine is about optimizing your health, getting your whole lifestyle firing on all pistons so that your lifestyle promotes wellness. And when you find something wrong with someone in this medicine, you will create a plan that's very individualistic. Like if I find something wrong with Darshan, it won't work for you, Kevin. Vice versa. It's very much tailored to him. So it's optimization of health. It's very individualized. It's the root cause. And we look at a lot of lifestyle stuff that regular medicine doesn't look at. For example, how were you born, vaginally or C-section? Were you breastfed? Any toxin exposure? Any childhood stress? Have you ever had any head injuries and got knocked unconscious? Have you had, what kind of water do you drink? What kind of food are you eating? How are you dealing with stress? Are you working out? How are you sleeping? Then we get to the mind and the spirit part, which is lots of stuff.
Yeah.
So, it's not spend 10 minutes with my doctor and get a pill and leave. It's like you're diving in for a good hour and a half, 2 hours, learning everything about this human being. So it's very in-depth. It's very, comprehensive. And once you learn all these things about someone, it's not that hard to jive here and figure everything tightened up and getting their whole picture put together.
Exactly.
Yeah.
Exactly.
And we're learning that, we used to think genes you got this gene, you're screwed, you're going to get this disease. Not anymore. It's all epigenetics now.
Right.
And so that's where the whole lifestyle thing comes in. Your lifestyle and your environment will affect the expression of your genes, right? And this goes on all day long. Genes are turned off and on all day. So it's just in depth. It's really fascinating. Really cool.
It really is. Yeah. I just had the whole genetics conversation with someone today about, he thought, well, can't you just do a genetic test and figure everything out? Sequence my whole genome. It's like, it is actually, we know now that your genetics, unless you have a real genetic disease, there's very little there that's helpful, actually.
You're right.
Right?
You're right. I think they estimate that the gene you have may be 2% up to maybe 20% influential on your health. That's it.
Wow.
Yeah.
Not that big a deal.
And it's really about the epigenetics, which I think you should talk about that a little bit. Let's define epigenetics and what that is.
It's just the study or the influence of your lifestyle and your environment on your health.
Right.
So, for example, if you're sitting on your ass on the couch all day, you're not exercising, you're eating chips and pizza, drinking soda, you think the world sucks and you're negative and you don't, you're not into health, you're going to turn on genes that are bad for you and you're going to get something wrong. And then there's the other person who's eating 70% plant-based, exercising, meditation, doing float tanks, doing stuff you got here like IVs and laser light therapy, detoxification. That's super important. So if you do these things in your world, you will not get sick. You will not express these bad genes.
Exactly.
So you're saying that actually turns on and off genes?
Right.
Wow.
And now we're learning, this is so crazy, that our thoughts are now turning off and on genes.
Wow.
We're seeing protein expression from genes get turned off and on just by thinking different thoughts. Pretty crazy science.
That's pretty
It's all quantum stuff.
Right.
Yeah.
It is done through methylation pathway. So when you add the methyl groups to the DNA, it turns on and off genes, unwinds histones. It's like you could see this stuff in microscopes and scientific experiments. Like you actually see this stuff happening, right?
Yeah.
Yeah, it's pretty incredible. And like you said, thoughts do that as well.
That's bananas.
Yeah.
Because what happens is you get the power back.
Right.
You get your power back to heal yourself.
Mm-hmm.
So that's my whole where I'm moving is teaching people how to heal yourself. You don't even need me or Darshan or you.
Yeah.
Right.
You know.
You think yourself into health, right?
You can. You sure can.
Absolutely.
Yeah.
Well, I haven't been sick in 4 years, and for me, it's just not an option. I mean, ever since we launched Next Health, I haven't been sick, and I just refuse to. Like, I just don't feel like it's possible for me to get sick right now.
That's good. See,
and I haven't.
You manifest what you think.
Right.
There you go.
And I'm committed to that.
Right.
Good for you.
Yeah.
Right, absolutely.
It is.
I used to think the same thing, but then I took my kids to Legoland and it was game over.
Well, I got a couple years before that happened, so I'm going to keep with this thought process.
Those water parks and stuff.
Oh
my
gosh, it's like a culture
It's
dish
cesspool.
there. That's crazy. Every kid had snots running down their face.
Exactly.
I got sick for like a week or two.
Exactly.
So, okay, let's talk a little bit more about the mind-spirit connection that you're diving into. Kind of what's your process around that with people?
Okay, so, like I mentioned, it's the way people think that affects your health, right?
Mhm.
So let me give you an example. There was a study done, I think it was last year, and whose sponsor was IKEA, the furniture people. You can go Google this. This is pretty cool. They took 2 small trees and they put them in a high school, and they put them in a glass box where the kids could not touch the trees, but the trees. They were separated by about 15, 20 feet, and they were in a glass case. They got the same sunlight and the same water every day to keep that consistent. One of the trees was praised and loved. You're the best tree ever. You're so amazing. I love your leaves. You're so beautiful. Just all this taking selfies, and they were just loving on the tree. The other tree was bullied. They were like, you suck. We hate you. You're the worst tree. No one likes you. You need to die. You're awful. They just were bullying this other tree. So same water, same sun every day. 30 days goes by. You got to go look online, look at these pictures.
Yeah.
That tree on the right that was getting praised was blooming, strong, beautiful, vibrant. The other tree is wilted, half yellow, and dying.
No
What?
way.
Yes, the pictures say it all. So
Gives me chills just hearing that story. It's
So-
crazy.
But look, that's what I'm talking about. Like,
Yeah.
that's the vibe, the energy these kids gave to a living thing. The negativity, the angst, the anger, whatever.
Yeah.
But people are walking around out on the earth with that crap in their head.
Right.
I suck. I'm not lovable. I'm afraid to be vulnerable, whatever it may be. So they're walking around like that, creating this, and your cells feel that just like the plant did. See? So look, it's all perception. Perception is everything. What your mind perceives, your body will follow. So for example, let's say, Yale did a study where they had people who were old, and the older people in the study who had a positive perception of aging, they didn't see it as a bad thing.
Mm-hmm.
They actually lived 7 years longer than the rest of the group, and they had less heart attacks and strokes than the rest of the group.
Wow.
What day of the week do you think heart attacks happen the most?
Monday.
Very good. It's the perception of the stress, the week's
Right.
coming.
Right.
And I think Harvard did another study where they did these 2 groups of cleaning ladies in a hotel.
Mhm.
And they told one of the groups that, do you know that all the rooms that you clean all day long, that's the equivalent of you working out for like 2 hours or whatever. And they're like, really? Okay. So after a month, the other group, they didn't tell that to, just one group.
Yeah.
So these ladies are in there cleaning and they're thinking they're working out and, oh my God, I'm doing good for my body. So a month goes by and they check their blood pressures. They compare groups. Blood pressure's lower in the group they told that to, and they lost weight.
Wow.
The other group, same work,
Mm-hmm.
didn't lose weight, didn't lower blood pressure. Nothing.
Incredible.
It's wild. The craziest thing of all, I
Yeah.
think, is the most fascinating with perception is multiple personality disorder. That is bananas. So you got one human being with 2 personalities, and this is true. One personality could have diabetes and they have high blood sugar. They literally have high glucose in their blood. The other personality doesn't.
Huh.
One personality is allergic to oranges and will break out in hives. The other personality can eat orange and nothing will happen.
Oh my God. And they've looked at this in
Yeah.
studies?
Oh,
with
yeah.
People?
Yeah.
Oh my gosh.
Tony Robbins has a book and he talks about all this stuff. So that's crazy. That's crazy stuff.
Yeah.
So, it's like the placebo effect.
I was just going to ask you about the placebo effect. Right.
It's the same thing.
Exactly.
Taking pills, my pain goes away. It's just a sugar pill.
Mm-hmm.
They've done a study where they gave people fake oxygen
Mm-hmm.
and their altitude sickness goes away.
Right.
Wow.
Right. Yeah.
So it's the mind body.
Totally.
It's amazing.
Yeah. I just read a study about placebo where even if you don't even take the placebo, you just have a can of placebo in your house, your pain goes away.
Really?
Yeah.
Oh my God.
Just knowing you have this on the shelf.
This could help me if I take it. That's all you need?
Right.
Oh, wow.
Right. Just having it there.
Crazy.
I know, it's just craziness. So what do you, when patients come to you and you ask them about, like, you do a deep dive into their past, their medical history, their psychological history, all of that. And then how do you change people's perception of themselves?
So one of the biggest things is negativity. Negative people get sick more, they die earlier. We know this. So if I ask them and, you half glass empty kind of person and they say yes, we go into that why, where's it from? And usually it's from childhood. It's usually from childhood. They have this negative perception of themselves. They learn something, the behavior from their parents because they see it and they think mom and dad know everything. And the best way to change people's negativity by far is to have people journal 3 good things that happen to you in the day every single night. Not I'm grateful for, but good things that happen to me. And you can never repeat them ever. So what happens to you is you're going to get stuck one night. You're like, oh crap, I don't know what to put. I've already put all this stuff down. What do I do? And I got to think of something. So it makes you think about your day and you start to realize little things that were good. Little things like, you know what? That cute girl smiled at me on the elevator. I kind of like that. Or that first morning sunrise came up. I kind of just stopped and looked at it for a second and was like, wow, look at that. I don't know. I saw a little kid playing with another kid and it was kind of funny. Just little things start to happen. So if you do this every single night, you see the good in your day. And what happens is the subconscious mind starts to look for those things in the day, no matter what. So you're going through your days and you start to notice, wow, that's kind of cool. That's a beautiful tree. Look at that flower. Look at that. Look at the clouds. Oh, see the full moon. Oh my God. You start to see little things in life that we all blow off. And you start to change your perception of the world and you become more positive because they're good things.
Wow, I love that. That's like such a simple way to reprogram your mind.
Totally.
Exactly. It's just rewiring. It just takes time. It takes practice because we're so wired and hardwired from little people. And it's just changing that. The mind has plasticity, we can change the brain.
Exactly.
Yeah.
I bought my kids 5-minute journal for kids. So I bought all my friends 5-minute journal. I think I got you one once, right? And have you ever seen the 5-minute journal?
Yeah.
Yeah. It's on Amazon. Anyone can find it, but they have one for kids.
Interesting.
And my kid, he's 6 years old, and every night we fill that out. And they make him draw a picture of one good thing every day.
Okay.
And it's great because he actually has to sit there and think about what was good in the day.
This is awesome. Brilliant.
Yeah, brilliant.
You know why? You're changing the generation to see the world in a different way.
Exactly.
Thank God.
If you have kids, get the 5-minute journal for kids. It's like
that's
game changer. And he's a happier boy. I really believe that. Yeah.
There you go.
I know, it's amazing.
So that's how you're going to change this whole planet. When people start getting like your son and his friends, they're going to be different people than we are. And we're going to see a global improvement in humanity.
Yeah.
Really, that's amazing. Good.
I absolutely believe that. So you're seeing patients, you're talking to them about their perception of themselves. That's one big category that you're focused on. What are some of the others? You mentioned spirit.
Right. So the spirit to me, it's about spirituality to me means that you believe in something bigger than you. It doesn't matter if it's God or, Buddha, whatever, or you don't believe in that. You believe in something, the universe, something bigger. And I want people to tap into that, and I want people to tap into themselves, their soul. And the way I like to go that route is about meditating. Like, I love Brain.fm, the app. This is an app that plays this music, and it's very atmospheric and cool, and there's hidden tones in it. It's not binaural beats, it's similar, but the tones pull your mind into theta wave, which is that monk meditative state that's trancey like. And I have patients listen to that, and I have a meditation that I teach them to do, to visualize, and to ask questions to the other side, to get downloads from the other side. And I walk them through how to do that and how to meditate. And in the meditation, I'm teaching them how to heal themselves, what to see, what to feel.
Wow.
Yeah. So because when you start doing that, the mind can start healing you. You see what I'm saying? It's the mind body. I'm tying in the mind body thinking.
Right.
So, like in Dispenza's book, he talks about ways to do that.
Huh.
Like for example, like Harvard, I think it was Harvard, did a study where they had two groups of people and they had to memorize a piano, 5 notes on a piano. So one group actually played the notes on the piano. Bum, bum, dun, 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 1, 2, 3, 4, 5, 2 hours straight, 5 days a week. Then the other group didn't touch a thing, but they visualized themselves, close their eyes, piano in front of you, hands sticking out, doing the same keys on the keyboard. They didn't touch a thing. So at the end of the study, they did brain scans, and both groups showed new neuron growth in the part of the brain that controls your fingers. That's crazy.
Wow.
This group did it with their hand. That group didn't do anything. They just visualized it.
Wow.
So new neuron growth. So to take it further, like University of Ohio, they did a study where they put people's arm in a cast for a month. You guys go home, come back in a month, we'll take it off. You guys go home, but I want you guys to visualize having a weight in your hand and flexing your wrist muscles. Just look at first person, looking down at your arm, just grinding out with the weight. And so they did 11 minutes a day, 5 days a week for a month. Come back, take the cast off. The group who visualized, their muscle fibers were twice as strong as the other group.
Wow.
Amazing.
So you're seeing like how the mind can heal, the mind can do things to the body. So why not apply that to pain? Or people have tumors and do this. We learned in med school about people who melt their tumors away with their mind. They visualize that tumor as an iceberg, and every day it's kind of shrinking. Remember the video game Asteroids? They would shoot the little asteroid, big, too little, breaking it up, and every day, and they get better.
Exactly.
So it's a modality that we're not tapping into in this Western world of ours that can be very, very powerful to heal.
Yeah.
See?
I feel terrible because I feel like as physicians, or at least the way I was trained as a physician, the physicians I talked to, they consider all of this very woo-woo and very just totally almost like, you're not following the standard of care if you even talk about this.
Right.
And you're sending people off in the wrong direction. And I just feel like medicine has just gone totally opposite of what of really tapping into any of this.
It's true.
And it's become almost where you have to rely on pharmaceutical industry to treat something because you have no other tools, and every other tools is discounted as magic or something. Right.
It's true. Like, do I advocate you have a tumor that you just go meditate it away? No.
Yeah.
It's one of the treatments that it's one of the things you should be doing on top of like everything.
It doesn't
else.
hurt at all.
No, you might, it's been done. I'm just saying you have to use Eastern and Western if you have a mass or some kind of cancer. It's
exactly.
just, integrative everything. But look, you're a doctor too. So we get this, we think science is our rule book.
Yeah.
So what if something doesn't prove if it works or not? If it works and it's anecdotal, people get better.
Yeah.
Who cares?
Right.
Why not?
Right. It's all about the result.
It's the result.
Yeah.
If you say that to a lot of physicians,
right,
they're going to think that you're crazy, that you don't have a double, a randomized placebo-controlled double-blinded study proving that meditation reduces tumor size.
Right.
So therefore, don't even use it. Right.
Right. But it does help, and we see that, and it's What I am seeing, though, however, is more people I'm talking to in Los Angeles, other physicians, I'm seeing doctors starting to open up to this. Why? Why is because patients are opening up to this stuff.
Mm-hmm.
They're learning about it. They're getting into it, and they go to their doctor and say, hey, and I'm thinking about trying this modality for therapy. What do you think about this? Or I'm thinking about doing acupuncture. I'm thinking about doing whatever it might be. And these docs are going, well, I'm forced to look into that. What is this all about?
Yeah.
They start educating themselves because the patient brought it to them.
Right.
So there's definitely a movement of people waking up and taking control of their health.
Mm-hmm.
That's for sure.
I think without a doubt, we're on the cusp of a revolution in health,
You
in
got
healthcare, whatever you want to name this. I mean, that's what we think. We're playing a part of that with Next Health. But what do you think? Do you think we're at the point where maybe some of this would actually start getting integrated in the early stages, like in med school? Or do you know of any of this that's has med school changed at all based on how far we've changed in the actual real world?
Yeah, it is actually. There's more and more residency programs are offering integrative medicine, and fellowships in integrative medicine are now popping up now.
Wow.
It's definitely rolling.
That's huge. I mean, that's the biggest indicator.
That's it. Yeah.
I have a cousin who works at a cancer center and some friends that own cancer centers, and they're all putting in integrative cancer treatments as an add-on to their cancer center because they actually do believe it helps, and it works very much in synergistically with what they're doing.
Yeah, it does.
Improves their success rates.
Exactly.
And for them, it's all about success rate and treatment rates, right? So that also speaks to that.
That's huge.
We're making a movement.
It's happening.
Yeah.
So what's going to happen is that when people and patients start changing and they're forcing doctors to look at new things, it's just going to keep trickling upstream.
Right.
Eventually, it's going to become more mainstream.
Yeah, it's so exciting.
Yeah, and I think you need a team. I think if you're sick, you need a team. You got your functional doctor, a regular doc, you got your surgeon, you got your acupuncturist, you got your healer, you got whatever you need to support you.
Right.
What else is there?
Yeah.
Yeah.
Really.
Awesome.
Yeah.
So you're on the cutting edge of everything functional medicine. I know I run into you at every conference that we ran into the peptide conference.
Oh, yeah.
That was fun. And it was like the first peptide conference ever, and he's there and I'm there. It was fantastic.
That's cool.
But tell me, what are some of the new tools in your toolbox that you're using?
I think you said peptides is probably the biggest thing right now. That's amazing. These are little peptides are tiny proteins, and they're signaling molecules. We have over 7,000 in our body, but man, they're finding newer and newer ones and more utility for them. We see a lot of them I use them a lot in my practice for anti-aging, for body composition, autoimmune disease, protocols I have for Epstein-Barr virus or Lyme. They're very powerful agents that I think that whole world is, coming.
Yeah.
Coming.
Can you define that a little bit more? Because I think it's such a fascinating topic, and I don't think most people really understand what peptides are. Yeah.
Well, a protein is, picture in your mind a protein. It looks like a pearl necklace.
Mm-hmm.
Take a pearl necklace and kind of wad it up in a little ball. That's what a protein looks like. And every pearl is an amino acid. Okay. Now, a peptide is basically a protein, but it's small. It's less than 50 amino acids long. That's the definition of a peptide.
Okay.
And peptides in our body, or proteins, act as little signalers. They're like little molecules that tell other cells what to do.
Okay. So they actually are proteins. They're just miniature versions.
That's right.
And once they're below a certain size, they're defined as a peptide.
Exactly.
Okay.
Perfect. So you can the downside of peptides kind of is they're injectables. That's the downside. You have to give yourself shots, which is not a big a deal.
Yeah.
There are some oral and topical things too, but most of them are injectables. But man, talk about healing, talk about boosting stem cells, talk about, you can't stop aging, but you can certainly kind of put the brakes on a little bit by, I'm not an advocate of growth hormone use, but there are peptides that can boost your own endogenous growth hormone. You'll tell your brain to squirt it out.
Yeah.
So you get your own natural rhythm if you need, so to speak.
And how does that work though? Because we have all of these peptides in our body, and every peptide has a different function. So then we're taking these peptides and injecting them, and that's causing more of that internal function that's very
Correct.
targeted.
Exactly. They're hitting receptors on cells and telling them to do stuff.
Got it.
Like generate new cartilage, generate,
Mm-hmm.
a muscle cell or whatever. So that world is booming.
Yeah.
Booming.
Mm-hmm.
Yeah. Yeah. So I do a lot of that. Was in the stem cells for a while. I kind of backed off a little bit on that. Exosomes and things.
Yep.
But like I said, I'm really more concentrating on the whole mind, spirit part of the person's health. Yeah, I take care of the body, of course, but depends on what they're there for.
Yeah.
Right. That's
Right.
fantastic. What are some of your favorite peptides that you use? We are launching some peptides here, but we're looking at peptides and just really waiting to see what research comes out to show which ones work. But like some of them have a ton of research behind them, right? So I know CJC, ipamorelin is a good combination.
I love that one.
That's a great one. And what that one does, well, I'll let you explain it. How do you explain
that's
CJC,
the one. That's
ipamorelin?
like a growth hormone releasing hormone and growth hormone releasing peptide that
Exactly.
it tell the brain to dump out growth hormone.
Mm-hmm.
So you get this nice pulse of growth hormone from the brain. So growth hormone is like your anti-aging hormone, right?
Right.
Fountain of youth, so to speak. So the only time you dump out growth hormone is when you sleep. It's the first sleep cycle. You go in, your body squirts it out for half an hour, and then your body shuts it off.
Yeah.
Now, if you exercise, you will dump out more growth hormone too. So, but taking these peptides tells your brain, hey, let's dump out it again and again and again. So you get the benefits of that. But it's pretty safe because your body's mechanism of turning off the faucet happens.
Mm-hmm.
When you take human growth hormone, it's in your system 24/7.
Right.
There's a lot of side effects. You get nerve
Right.
pain, your diabetes risk goes up. Theoretically, if you have cancer cells that are brewing somewhere, you could stimulate those cancer cells to flourish, and then you got a tumor, and then you got a problem.
Right.
Yeah.
That's why I'm not a fan of it.
Got it. That sounds amazing.
Yeah, it's good.
Yeah.
So that's a good one. I use thymosin alpha 1,
Right.
thymosin beta 4. Those are great for any autoimmune disease.
Right.
Healing. TB4 is amazing post-op healing.
Yep.
BPC 157, that's a great one.
Right, exactly. And then just melanotan if you want a tan.
Yeah, I haven't tried that. Have you tried that yet?
I have not tried it. No. But there's
Are you?
No, I just got back from Hawaii. That's why.
Yeah, buddy.
there's a lot of these too. They're great for sexual function too. So
That's true.
Yeah. Yeah. So yeah, the more research that's being done on them, it's pretty incredible. Some of the effects you can get with peptides.
I mean, this sounds to me like one of the most powerful breakthroughs in biohack and functional medicine ever. I mean, it seems like these peptides can do almost anything, like, right? Almost any body function.
They're really helping lots of different things that we were stuck we're having a hard time treating.
Mm-hmm.
They're like a new way of looking at things, like, in the peptide society that we're in. I read the boards and the docs talk to each other, and some docs are getting out there, man. They're really doing some really cool stuff. Like one guy, I was reading a case of his, he had a guy with a stroke and he was giving him these high dose peptides 4 years out, and his symptoms were actually started to get better, like paralysis and numbness and stuff. So that's amazing. It's like something where you think that guy's, that's how you're going to be, buddy.
Yeah.
And now he's have his chance to reverse that.
Wow.
I mean, there's some real cavalier guys out there that are, throwing it out. I love it.
Yeah, it's pretty amazing.
Did we just discover it recently?
No, they've been around for a while.
Yeah.
Europe.
Got it.
Yeah, Europe.
Over a decade, I believe, right?
Right.
Amazing.
Russia did a lot of research on
That's it.
peptides, especially for anti-aging.
Yeah.
And, these things, unfortunately, because they can be synthesized in a laboratory in a compounding pharmacy, drug companies can't make money off of them.
Got
it. It's kind of bypasses the whole pharmaceutical industry. So they were kind of kept out of our radar for a long time in the United States.
Got it.
See?
Yeah, right. Big pharmaceutical. Exactly.
Yeah, same thing. Yeah. Sad.
Yeah.
I mean, it's about healing people, man. I don't get it.
Yeah.
But from their end, it's about money.
Right.
Yeah.
Yeah.
We see a lot of too. We see a lot of people with a lot of toxin burden, just living in LA. Right. And, what is, I'm sure you do as well, of course. So what do you kind of, tell them? What advice you give them? What kind of strategies you give them to detox?
Okay. So The detox, you got to do a few things. Number one, you got to pee, poop, and sweat. That's for sure. So peeing means you need to drink half your body weight in ounces of water a day minimum. 200-pound guy needs 100 ounces of water minimum. If you're sweating, you need more. Keep your system flushing. Poop means you got to poop every day, at least once a day. So we got to make sure their bowels are going because that's just toxic waste. And sweating is huge. Sweating detoxifies you a lot. So whether you're working out and sweating, whether you're in an infrared sauna or LED light bed, whatever.
Is there any difference in the quality there? Because would you think that sweating from working out, does that have a better detoxing effect than the sauna?
I honestly don't know.
Okay.
I don't know. But they're both good.
Yeah.
So that's what I get them doing first.
Yeah.
And then I talk about their lifestyle. This is because to me, you get a great question, Darshan, is toxicity is what can kill you.
Right.
So toxins, we have over 85,000 chemicals in the United States. They've sampled fat tissue from human beings and they have found over 500 toxins in our fat. They've done urine samples on adult people and they'll find over 7 different pesticides.
Umbilical cord blood.
Umbilical cord blood, yeah. Lots of them there.
Newborn babies.
Terrible.
Wow.
With hundreds of toxins.
Oh,
yeah.
So look, our bodies can't handle the burden. That's a crap ton of chemicals that we're not used to. Our genetics are still like cave people. So what you have to do is minimize your exposure. So I tell patients, look, think about it this way. What goes in your body, on your body, and around your body. In your body means your mouth. So are you drinking clean water? Don't drink out of plastic, filtered, reverse osmosis. Your food is organic as you can get, free range, grass fed, super clean food. Make sure that your, what we put on our body is key. So think about it this way. What you use to wash your clothes in. Got our clothes on our skin. What are you using to wash your body in? Soap, body wash. What are you using? Girls are putting makeup on and lotions and moisturizers and things like that. Dyeing their hair and all this other stuff. So on your body is a big deal. And how you know, like, what do I use? Well, look on labels. If you see fragrance and perfume on something, get rid of it. We hide about 30 to 40 chemicals under the term fragrance. And fragrance, those chemicals are big hormone disruptors, cancer causers, and yet they're in everything. So essential oils are fine if you want to smell your clothes clean, like lavender or lemongrass and that kind of stuff. That's totally fine. And I tell people get soap that's like olive oil soap from Greece or Turkey. I love Dr. Bronner's. You can get his stuff there. It's all organic and clean. And another one is like people wash their dishes in Cascade. They put Cascade pods and close it and turn it on. Why are you going to coat your dishes and silverware and glasses with chemicals and then put your clean water in that and drink it? See, so use a plant-based product, 7th generation or whatever. And, if you use a cologne, perfume, try to find something more essential oilish. Or if you love something, spray it on your clothes, not on your skin.
Yeah.
And then I talk about around you. So what does that mean? Where do you live? Do you see mold? Have you had mold? Is it like a grungy place? Do you need an air filter? We're learning indoor air quality is getting worse than the outdoor air quality. So you need to open your windows and let the stuff circulate. Let it get a fresh set of air in there, so to speak. And Wi-Fi, turn it off at night. If you have your cell phone, put it in airplane mode. Well, you don't need to put that thing by your bed and it's blasting your head all night. I hate those earbud things. They're wireless. So why would you put something in your skull? They're actually in your ear hole, in your skull, sending out a signal to pick up something. It's going into your brain. I mean, it's logical. So get wired things. I tell patients get wired. It's not as convenient, okay, but
or speakerphone.
Yeah, speakerphone, exactly. So in your body, on your body, around your body, pee, poop, sweat. Love infrared saunas. Those are amazing. And that's where I start them off on the path. Yeah.
Do you have any like cleanses that you recommend for people? I honestly, I'm not a huge fan of those. I don't think they really do a lot, but people love cleanses.
Yeah, I haven't used them much. I would love to design one and think about that. But yeah, you're right. I don't dive into that too much.
Yeah. Mold.
Mold.
How do you diagnose it in people?
Well, of course, just the history. Have you ever seen it? Then sometimes they have the fatigue stuff that you can't figure out, and you can do. I use Great Plains Laboratory.
Right.
They have a urinalysis test.
They're great for all sorts of toxin exposure labs. Great Plains labs.
They are really good. If they have mold, what I found to be really effective to get rid of it is ozone.
Yeah.
I will use ozone. I don't do it in my office, but I have people I know who do it, and I use ozone for mold.
We do ozone here now.
You do?
Yeah.
Oh, wow.
Right.
Yeah.
No way.
Yeah.
Good. There you go.
There
Okay.
you go.
There we
Send
go.
it us.
All right, here we go. That's good.
Yeah.
But I'll use ozone for mold. I'll use ozone for Epstein-Barr or Lyme. Any of those infections that are really tough to kill.
Yeah.
It's effective.
Wow.
It's effective. There's other things you got to do on top of ozone, but it's effective.
Yeah.
It's a big gun.
We use hyperbaric as well. We're
good.
doing hyperbaric at our West Hollywood location as
There you
well. Yeah.
Good. Oh my God.
Yeah.
Good for you.
Great technology to help treat any type of infectious or toxin exposure. I think some of this stuff really works.
Yeah.
Yeah. What are you doing as far as for people that are coming in with diabetes, heart disease? What's your kind of, high cholesterol is a huge problem. High sugar is a huge problem.
Definitely.
What kind of advice are you giving them?
So you start with their lifestyle first. I'll really dive into how are they eating? Are they exercising? Are they sleeping? Sleep's a huge issue. Oh my gosh. And probably where I start with everyone, number one is sleep.
Yeah.
You fix that, you're going to fix lots of other stuff downstream. It's kind of a snowball effect of improvement.
Absolutely.
We start their lifestyle and their diet, get them exercising, check numbers.
Right.
I'll have them go kind of plant heavy on their food, more plant based with less animal protein. Still getting some, but not as much as they were. And the cholesterol profiles, which you mentioned, you got to do an NMR, which is the particle sizes.
Right.
You can't just do the 5 numbers and you're done. It doesn't tell you enough. So you look for cardiovascular inflammation. Is the vascular system inflamed? Are you oxidizing your bad cholesterol, which causes plaque, which causes heart attacks? Being in the ER, I've seen a ton of heart attacks.
Right.
50% of people who have heart attacks have normal cholesterol.
Yeah.
It's not the vast we thought it was. There's a lot of other factors. It's the immune system, it's sugar, it's inflammation, it's the sizes of the particles that matter. 2 people have a 170 cholesterol, which is normal. The one who has the smaller particles, that's the one who's going to have a heart attack, not the one with the big one, the bigger particles. The big particles just bounce down the arteries like beach balls. The small particles hit the wall and bury, stick, oxidize, start the whole plaque cascade, and you got a little blockage starting to form.
Yeah.
So, I've seen a lot of good improvement with cholesterol numbers.
Right.
And I use a lot of supplements that don't use statins.
Right.
I'll get you off of the statin.
Right.
You only need a statin if you're a middle-aged man and you have documented evidence of plaque to me.
Right.
They don't work in women that great.
Mm-hmm.
And so I'll use other natural modalities and lifestyle changes.
I feel like everyone's on statins right now.
Oh,
it's
yeah.
just like they're giving it away
huge.
like candy.
Totally.
Yeah.
They're good if you have plaque because they stabilize plaque.
Right.
They don't let it rupture. That's why I like them.
Right.
But you don't need it every day. You can meet sometimes, like I'll get patients on it 3 times a week. They have a long half-life. They last in the body a while.
Yeah.
It just depends. It's everyone's different and specific,
And do you utilize a keto diet at all?
No, I'm not a fan of keto.
Really?
No.
Why?
It's hard to maintain.
Mm-hmm.
It's hard to maintain. I will check some genetics on people. And if you have the ApoE gene,
right,
which is a 3-4 or a 4-4, you got a problem, even 3-3 people. So in other words, they have the genetic predisposition that if you have a lot of fat, your cholesterol is going to go bananas. So I'll always check on everybody. Now, some people can do it, but I just find it hard to tolerate, to stick with.
It's hard for people to stick
super
with.
hard.
Absolutely. Yeah. So the reason I'm rapid firing questions on you is because I know that you have a ton of knowledge in all of this. We get asked all this stuff all the time here. And you're like the expert here, I think, in LA, and definitely, one of the top functional medicine docs in the country. So it's great to have your current perspective on things.
Yeah, absolutely.
Thank you.
Awesome.
Appreciate that.
Yeah.
So happy to have you on the show.
Good to
Thank
be
you
here.
so much. We got a lot of information from you. We're starting an event with you in a few minutes here. So they're all motioning me to help get you off the mic so we can get you onto another mic.
All right. Sounds good.
Awesome. So how do people find you?
You can go to my website, drlekkos.com, drlekkos.com, and you can reach me there.
Right. Thank you so
Thanks
much
for having me.
being here.
Good luck to you guys.
Awesome.
Thank you.
Good luck to you as well.
All right,
Thanks.
thanks.